Good morning, everyone, and happy Black History Month to you. I am Nicole Jackson Williams, first Vice President of Alpha Kappa Alpha Sorority Incorporated, Xi Omega Chapter. Thank you all for joining us today for this event as part of our Love Yourself, Love Your Health series of events for Heart Health Month. This month, the women of Alpha Kappa Alpha trade our beloved pink for red to raise awareness and promote life changes for women around the world. Heart disease is the #1 cause of death in African Americans, and this risk only increases as we age. The goal of this event is for our viewers to learn more about heart health and the importance of eating well and proper oral care as a part of your everyday routine. We hope that you find this discussion engaging, informative, and that it encourages you to take the necessary steps to prevent or reduce your risk of heart-related health conditions. We'd also like to inform you about upcoming events that we have here at Xi Omega Chapter, which includes on February the 28th, there will be a Grow with Google watch party. On March 3rd, we will observe Triple Negative Breast Cancer Day, where we will host an educational webinar. And on March 30th, we will also host another educational webinar called Know Your Risk, Diabetes, Heart Disease, and COVID-19. Be sure to follow us on our Facebook page at AKA Xi Omega or connect via email at programs@akaexo.org. Again, thank you for joining us, and we hope you enjoy the program.
Thank you, Nicole. And welcome to the 2022 Healthy Start, Healthy Heart Breakfast webinar in collaboration with the American Heart Association. I'm Diane Johnson, Alpha Kappa Alpha Sorority Incorporated, Xi Omega Chapter, here with Jasmin Hunter, also a member of the sorority. How are you, Jasmin?
Hi, Diane. I'm happy to be here with you this morning. How are you?
I'm excited about today's program. We have a panel of experts who will guide us onto the path to better health. Joining us this morning, Dr. Aubrey Grant, third-year General Cardiovascular Disease Fellow at Georgetown University, MedStar Washington Hospital Center, Dr. Iris Jeffries Morton, D.D.S. Emeritus Professor, Howard University College of Dentistry, and Ms. Renee Key, Head of Nutrition Education, Capital Area Food Bank. Welcome to all. Dr. Grant, let's begin with your sharing the specifics of what you do as it relates to a healthy heart.
Well, good morning, everyone. I'm very glad to be here with you all today. My name is Dr. Grant, originally from Prince George's County, Maryland, and I'm a third-year General Cardiology Fellow at Georgetown University. I have specific interests in health equity, health disparities, and all things related to improving, health, particularly in the Black community, and for people that look like me. As a cardiology fellow at Georgetown, I take care of the run of all the sort of types of heart disease that present to the hospital. I work at Georgetown and Washington Hospital Center. I really want to focus on prevention. And so it's so excited to be here today to hear you guys talk and learn more about ways that we can sort of prevent heart disease, because once we sort of have established, a pathology of heart disease, it can be that much more difficult. So wonderful to be here today. I also wanted to give a shout out to my mother, because she is one of the newest members of Iota Gamma Omega Chapter of Prince George's County, Maryland. So super happy to be here today with you all.
Well, thank you so much. And I am sure Mother is proud of that shout out, as she should be. Dr. Morton, share with us what you've done throughout your career and the inspiration that led you to dentistry.
Good morning. Thanks again for inviting me, and I'm so delighted to share with you my 40-year journey in oral health. I am recently retired as the head of oral diagnosis at Howard University College of Dentistry. In oral diagnosis, the focus is a little different from private practice, because we are looking at the systemic issues and how they affect the oral cavity. We are looking at all systemic issues and their relation to the oral cavity. So as a private practitioner, I experienced these diseases throughout the ages, from young children to the middle age group to the elderly population. I saw how the oral cavity was affected and how it changed. But in the past 20 years, I've been teaching at Howard, and I just retired on December 31st, where I chaired oral diagnosis. So that's what I have done. It's a passion of mine to work with other disciplines. We are taking now an interdisciplinary approach to healthcare. And I think that is essentially important for the African American population and the underserved.
Dr. Morton, congratulations on the recent retirement. And it sounds like your inspiration was your passion.
It was.
All righty. Well, we're going to come back to you with lots of questions. Ms. Key, tell us about your work as a registered dietitian and what led you to that field.
Sure. Hi, everyone. I hope everybody has energy this morning because you ate a nice, heart-healthy breakfast. I'm excited here to share some of the knowledge I've had gained over the years. I have been a registered dietitian for the past 7 years, but I've been in nutrition education space for the past 15 years. I've been doing nutrition education with all different populations. Particularly, my focus is on weight loss and heart health and diabetes, but I span the range in terms of the top topics that I focus on. Right now, I work at the Capital Area Food Bank, where we educate individuals who have more limited resources on ways they can eat healthy, specifically on a budget. So I'm excited to be here. I'm excited to share more with you.
Ms. Key, I am very interested in hearing some of your recommendations for a heart-healthy breakfast that tastes good, because I just finished staring into a bowl of whole wheat. Well, I don't know what it was, but it wasn't very good. Bran, that's what it is. Lots of fiber, not very tasty. So I am really looking forward to what you have to tell us. Jasmin,
I look forward to sharing.
Thank you. Jasmin?
Thank you so much to our esteemed panelists. So this morning, our event is called the Healthy Start, Healthy Heart Breakfast. And from our audience, our attendees, we wanted to get an idea of what a regular breakfast looks like for you. So if you have the capacity, please put in the chat right now what you normally eat for breakfast, or if you're enjoying a meal with us right now, let us know what you're eating right now, and then we'll have our registered dietitian, our professional here, kind of rate what we're having and give us a couple of recommendations for how to make a healthy start. We'll give you guys a couple seconds to enter in what you might be eating for breakfast right now. Maybe you start your day with just a cup of coffee or a cup of tea. Maybe you have something light like an avocado toast, whatever it might be. Registered dietitian Renee Key is here to help us to make the best choice for our mornings. Let me see. Okay. We've got yogurt with water or coffee, eggs, whole wheat toast, green juice. Okay. Dylan Hammond is making really good decisions in the morning, I see. Oatmeal, chopped walnuts, sauteed kale and spinach. Wow, I think we've got a lot of really informed people. Fresh fruit, I see in the chat. A protein shake or egg whites. Couple slices of bacon. I feel like bacon doesn't hurt, but you can definitely tell us, Ms. Key. Let's see, a couple more: scrambled eggs, spinach. I see a lot of oatmeal, a lot of whole wheat toast. I think a lot of our attendees are on the right track. That's really great to hear. So, Ms. Key, based on the answers that you've seen in our chat, my first question to you would be, what are the current guidelines for a balanced meal? And then how does this change? How does this advice change as we age?
Absolutely. So you can see on the screen in front of you that a balanced meal is mostly going to incorporate lots and lots and lots of vegetables. And that's why I'm excited to see that some of you have written in the chat that you actually eat sauteed kale and spinach. Who is that? Someone, Charlotte. That's amazing. So vegetables should be at least half of whatever you're eating throughout the day. And that includes breakfast. And I think a lot of times people, when they think about breakfast, they're like, vegetables for breakfast. But sometimes we have to go through like a mind shift, right? Like we have to change the way we think about breakfast, because it doesn't always have to just be pancakes and waffles, which I can see that you guys already know that you guys are good. So vegetables, some type of protein, whether it's salmon, it could be even something like peanut butter or nuts or something like that, something that's easy that you can grab on the go. It can be beans. I know a lot of people think it's strange to eat beans for breakfast, but it's actually a really powerful way to get a good source of protein, fiber, and all different types of things into your diet. So protein should be a part of your breakfast if you can. And then also having a whole grain. You can incorporate that into your breakfast, or if you want to wait for lunch or dinner, that's okay as well. But breakfast is, it's perfectly fine to have that for breakfast as well. And then the biggest thing that most people eat for breakfast anyway, which I see a lot of people are eating here, is fruit. So lots and lots of fruit, as much as you can throughout the day. I highly recommend it. And then also what you see here is a glass of water, drinking water. Other things are good as well. So in terms of like orange juice or milk or something like that, highly recommended, just in limited doses. Water, water, water. I always say water, 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 and more water. Or if you really want to add a really healthy boost to your morning or throughout the day, I would recommend just plain green tea. It's filled with antioxidants. It even has a little bit of a teeny bit of caffeine, which actually is good for heart health. People don't realize that. But a teeny bit of caffeine that gives you a kick throughout the day, and it gives you energy for the rest of the day. So if you're at breakfast, don't feel overwhelmed and feel like you have to get all of this into your breakfast, but just getting a couple of these items into your morning, and then you can get the rest throughout the day. Those are the general recommendations.
Great, thank you. So as part of a healthy diet as well, which vitamins and minerals become most important to consume as we age?
Great question. So with specifically with regards to vitamins and minerals, you will see when you read the nutrition facts panel, I don't know if people pay attention to the nutrition facts panel on the foods that they purchase, but a lot of foods that you're going to purchase that's in a package, all the foods that you purchase that are in a package are going to have this nutrition facts panel. And on the nutrition facts panel, there are 3 vitamins and minerals that are really important for seniors to pay attention to. One is the vitamin D, and you can see that the vitamin D is on this particular food item. I'm not sure what this particular food item is. It was a sample that the FDA had on its website. But this is vitamin D is really important. Calcium is really important. Potassium is also really important, especially with regards to heart health. Because when you're thinking about heart health, you want to make sure that the sodium is low and the potassium is high, because somewhere in between there, that's where you're going to find your healthy balance to make sure that your heart is pumping the right way and you're not overworking your heart at all. So those are the 3 recommendations. And I believe later on, we're going to go into specifics about where those particular items come from. So I'm going to hold off on that.
Yes, excellent segue, actually. Can you explain to us, and I believe we see on the next slide, what cholesterol is exactly, and then maybe the difference between, I've heard good cholesterol versus bad cholesterol. Can you give us some examples of what that entails, and maybe some foods to avoid to watch these levels?
Absolutely. Oh, great questions. I love these questions. So the first thing to know about cholesterol is that cholesterol is actually good for your body. You need cholesterol in your body. The problem we have is that sometimes we eat too much cholesterol, or we get too much into our system. So the first thing that's really important to recognize, it's just like sodium. Sodium is also good for your body. It's just the quantity that you're actually eating. So when we're talking about cholesterol, There's the LDL, which is your not so good cholesterol, and then your HDL, which is your very good cholesterol. Your HDL, I like to look at it like a plumber, right? So think about a plumber who comes into your house and cleans out your pipes, right? And makes everything flow correctly. That's what your HDL does. Your LDL does the opposite. I look at it as like the stopper. It's the thing that clogs up your pipes in the house, right? So that annoying thing, whatever is getting in your clog. So what you want to do is you want to make sure that your HDL, you're getting enough, you're raising your HDL and lowering your LDL. So to raise your HDL, you want to focus on wonderful foods like fruits and vegetables. I'm going to put it out there. Berries are one of the healthiest fruits and vegetables that you can eat, and it helps to raise your cholesterol. Also, like those handheld fruits with lots of fiber, like apples and pears, those are going to help to raise your HDL cholesterol, your good cholesterol. Green leafy vegetables, if you can eat kale, that's why I'm so excited to see the kale and the spinach, because if you can eat that, you're increasing your HDL cholesterol. Fatty fishes like salmon, and even things like albacore tuna, all of those are going to raise your healthy cholesterol levels. In terms of the LDL cholesterol, the lower, the ones you want to lower, the LDL cholesterols are going to they're going to, well, I should say this, they're basically found only in animal products. So if it's not an animal product, it's not going to have cholesterol. That's the general rule. A lot of people get confused that they say, you know, potato chips have cholesterol. They actually don't have cholesterol. Animal products are the only things that are going to have cholesterol. Things like, I should say, cholesterol and saturated fat is going to be found in animal products, as well as we'll come to saturated fat later. So I would just recommend highly that the cholesterol, that you decrease your cholesterol by decreasing the number of animal products that you consume. And then we'll go into a little more detail about like saturated fat and how that plays into it.
Perfect, thank you. I personally love berries, so I'm glad to hear that. So I think our next slide speaks a little bit to sodium. How should we regulate our sodium? What level should we stay at?
That's good. Another good question. So sodium, the general recommendation for the general population is 2,300 milligrams for the entire day. So you can see this particular item has 430 milligrams, which on this document, on this particular nutrition facts label, you can see that that's about 19% of your sodium for the day. So 2,300 milligrams is the target for the general population. If you already have heart disease, then that recommendation goes down to 1,500 a day, right? So that means you have to even be more diligent about the types of sodium that you're getting into your diet, because that 1,500 milligrams, it adds up quickly. So this is one serving, this is 1.5 cup of something. So if you ate this 1.5 cup of this particular food item here, then you only have about 1,000 more milligrams of sodium per day to pay attention to. I also just want to say in terms of sodium that it's important that we realize that about 77% of the sodium in our diet comes from processed foods. That means foods that have been packaged or changed from its natural form in some kind of way. So if you're eating a lot of processed foods, even going out to a restaurant or something like that, restaurants put tons and tons of sodium into their food. And so that's why we recommend that if, as much as possible, eat at home, prepare your foods at home. Or if you do eat the packaged foods, pay attention to these nutrition facts labels. And also when you go to stores or when you go out and, go out to eat for dinner, a lot of times restaurants will have nutrition facts information for you. So if you're really concerned about it, you want to choose the low sodium options, or you want to ask and say, how much sodium is in this dish? And they may or may not be able to help you, but that's a good something that you can take away, and a tip that you can use to help lower your sodium.
Perfect. And I think our next slide speaks to saturated fats, which is another one of those things that is a bit confusing, because there are, I guess, good fats versus bad fats. Can you explain the difference?
Absolutely. So saturated fat, again, your body utilizes saturated fat, but your body can make all the saturated fat it needs. So you don't necessarily need to get into your diet at all. It's fine if you don't get saturated fat into your diet. It's also fine if you do get a little bit into your diet, right? Just like with the cholesterol, it's just the amount that you want to get into it. And this is an interesting fact that most people don't realize is that saturated fat is actually the food, I should say the nutrient that increases your cholesterol even more than cholesterol itself. So you want to pay attention to the saturated fat even more so than cholesterol. And saturated fat is not just found in animal products, but it's also found in oils like canola oil, vegetable oil, and things like that. So you want to make sure you're paying attention to that. And when you're looking at things with oils that have oils in them and saturated fats, think about pizzas, cookies, baked goods, cakes, potato chips, all those things have lots of saturated fats. And then also moving over to different types of meats, beefs and things like that. Beef are going to be the ones that have higher levels of saturated fat. Your chicken, your turkey, as long as it's not fried, it's going to have a lower level of saturated fat than your beefs and things in and porks and things like that. But you want to make sure that you're focusing on looking at this saturated fat level. You can see here, this has 1.5 grams of saturated fat. The recommendation for the day is no more than 20 grams for the entire day. So you want to pay attention to that even more so than cholesterol.
Okay, thank you for that. So it sounds like we can still have our bacon, but maybe just once a day.
Yes, or you can choose like the turkey bacon instead of the pork or whatever other type you're eating. Or the Canadian bacon is also like a lean type of bacon. So yes, absolutely. And once a day.
Once a day. Great. Okay, so I think next we'll move on to some of the recommendations you have for breakfast for our seniors or just all of our attendees. So your example of a breakfast on the go, can you explain the elements of this?
Absolutely. So this is plain Greek yogurt, and I always recommend just plain Greek yogurt. And the reason why I recommend Greek yogurt is because it's so much higher in protein than any other yogurt that you're going to get on the market. I think there's an Icelandic yogurt that has a really high protein content as well. But in general, you're going to find Greek yogurt in most places, and it's easy to find. So I always recommend the Greek yogurt. And the reason why I mentioned protein is because as you age, it's harder to build up your lean body mass. And your lean body mass is important for a lot of several different things. It can be your heart health, your metabolism, healthy weights, and things like maintaining a healthy weight and things like that. So making sure you get protein in your diet and building up your lean body mass is really important. And another way you're going to do that is also as just a little bit of a tangent is through exercise. So if you're doing exercise and you're eating protein, you're going to be able to really build your lean body mass as you age, which is really important. So that's why I recommended the Greek yogurt. And then also, once again, those good old-fashioned berries. You can't go wrong with berries. They have antioxidants, they have fiber, they have so many wonderful things in there that it's going to help boost your health and your nutrition and your nutrient profile. And then finally, I recommend nuts. Sometimes nuts can be hard for some people to eat. If they are hard to eat, you can always grind them, or you can, pecans are a pretty soft nut. So those are, you can try incorporating pecans in with your breakfast. But I will say that the reason why I recommend nuts so much is because not only do they have a good amount of protein, but they also have a really good amount of what we call your healthy fats, which is what you asked about earlier. So you're going to get healthy fats, which also is really great for your heart. Again, it's one of those things that helps to clean your pipes. So nuts are really great for that.
Great, thank you. So our next example of a healthy, heart-healthy breakfast is something that can be cooked at home pretty easily. Can you share with us what that looks like?
Absolutely. So I wanted to incorporate this in here just to go back to my point that I made before about people thinking that you can only eat certain things for breakfast. You literally can eat whatever you want to eat for breakfast, right? Like it's whatever you want. And sometimes I think we get stuck in these patterns of, oh, I have to have eggs or I have to have bacon or whatever it is that you're eating. No, you can eat whatever. You can eat a salad, go figure, for breakfast. You can do that. And so here is a nice little breakfast with black beans, and it has some sauteed vegetables, or you can roast the vegetables, and avocado. Avocado is an amazing, amazing fruit, even though it's not sweet, but it is considered a fruit. It has lots of heart-healthy fats, and it's going to give you a lot of energy. And the good thing about avocado is that it doesn't really have a strong taste. So you can make it taste like whatever you want it to taste like. So there you go, incorporating vegetables into your breakfast. You have some nice protein, your healthy beans, and then you have a nice source of healthy fats right there, all in one bowl.
Great, and that sounds delicious. I actually prefer a savory breakfast myself. And so I think our last breakfast example is something that I think folks on a fixed income would enjoy and is a bit easy to access for them. Can you explain what this is?
Absolutely. So there is tons and tons and tons of research showing the health benefits of oatmeal on heart health, right? Like, so I always recommend, if you like oatmeal, I know some people don't like it, but if you like oatmeal, go for it. Eat it for breakfast, lunch, or dinner, or dessert, however you want to eat it. And then also, once again, there's that protein from the peanut butter. So it's not an expensive protein. You're going to get heart healthy fats. You're going to get the protein that I mentioned. And then also bananas is one of the least expensive fruits that you can purchase. But of course you can switch all these out for whatever fruits or fruits that are in season. So that's another tip for like just eating on a budget, is making sure you're purchasing in season, right? So if you're buying, blueberries in the winter, then those blueberries are going to be $5 for a little half a pint of blueberries. So you want to either purchase the frozen blueberries, which are also a wonderful alternative, or go with the things that are still inexpensive even in the winter, like bananas. They're inexpensive all year round, or focusing on whatever is on sale in the market. So.
Okay, great. We've got, and I did want to kind of have you help us with one or two pantry staples, something that we all need to just have on hand, or what are our best options for something that's quick, easy, heart healthy, shelf stable, things of that nature.
Absolutely. So all of these things, there's so many things that I talked that are here that I'm just going to pull one out. I'm going to say, if you're going to choose something to be in your pantry, I would say nuts is a really great source. Again, going back to the nuts, because you can get peanuts, which are not that expensive, or you can get, walnuts or pecans or whatever it is, and you're going to get lots of great nutrients through the nuts. Another thing that I don't think people are, I think a lot of people are starting to eat more of now, but lentils are a fabulous source of protein, lots of all different types of nutrients in there. You're even going to get some calcium in there. So if you can just incorporate, I would recommend all of these things listed on these on this slide, but lentils and nuts, I think are really important. And oh, I'm sorry, I will say something about the 100% whole wheat pasta. I actually brought a visual because this is one of my favorite pastas. Instead of eating the whole wheat pasta, which is totally fine, it just has lots of carbohydrates and not as much protein. I use this pasta. It's a red lentil pasta, and it's by Barilla, and it's a really great protein pasta alternative because it has 14 grams of protein per serving, first of all, and it's basically made with lentils, and it's actually delicious. It's hard to find a non-wheat pasta that's actually delicious. So I would recommend something like that as well. and it's easy to cook.
Ooh, that sounds great. As a pasta lover myself, I will definitely be checking that out.
Yes.
Thank you so much, Ms. Key. And for those of you who participated by sharing your meals with us, that was a really healthy discussion. And we captured all of your questions and we'll be answering them towards the end. So now that we've seen some examples of ways to eat healthy, let's take a few minutes to move our bodies. I'd like to welcome Jessica Howard Jackson, who is an expert registered yoga teacher, having completed over 200 hours of study. And she's also the owner of Green Sanctuary Yoga LLC. She'll walk us through a low impact yoga routine to get our blood flowing. Take it away, Jessica.
Thank you so much, and good morning to everyone. I hope you're feeling well, I hope you're breathing well, and I hope that you are enjoying what's being presented thus far. I certainly learned a lot in the last segment, and I'm glad to hear about eating the spinach and all that in the morning. I love cooking myself a little spinach and mushroom and onion medley, and it's always so good. So I want to take you all through a bit of movement and breath this morning, so I hope you're ready for that. Make sure that your chair is steady and stable, i.e. it does not have any wheels on it. If you have something with wheels and maybe you can lock, you may want to do that or switch to another chair. But just be mindful of that if you got one of those comfy chairs that roll around. So you want your chair to be the steady thing, okay? So in preparation for our movement, I want you to keep in mind a couple of things. If something doesn't feel right, if something might be achy this morning, just skip that particular movement and just join when you can. None of this should hurt. It should all feel good. And it should be an opportunity to just get some fresh blood flowing through that wonderful heart of yours. So I'd like for everyone to make sure that you're comfortable in your chair and that you're sitting up a little bit. So you're not necessarily sitting back in your chair. I want you to sit up, and believe it or not, just that action there might get your heart pumping just a little bit more, okay? So do this for me, please, and place your right hand on your heart. And then place your left hand on top of that. We're going to do a check-in. Okay, we're going to check in with your heart. And I'd like for you to just notice how it's beating this morning, how it's feeling. You've got your heart in your hands. And so if you can feel your heart beating, I want you to just take a moment to just experience what that feels like, to actually feel it and feel the work that it's doing on your behalf. It's all the things that are happening that you're not aware of about 100% of the time, but we need this. We need our hearts. They're essential. It's essential for them to be healthy. It's essential for you to acknowledge your heart. So I want you to just take the next moment or two, just check in with it, see how it's feeling. And we're going to come back to this at the end. So I want you to take note of how it feels in this moment. And then let's take a big breath in together, deep inhale, and let out deep exhale. See how that feels. Let's take 2 more breaths. Deep breath in, maybe smile, and let a deep breath out. One more time. Deep breath in, and a deep breath out. Go ahead and release your hands. Take your fingers and just take some movements with them. Perhaps you bring index finger to thumb, middle finger to thumb, ring finger to thumb, pinky. Take whatever movements you wish with your fingers. So you can do the nice count. Move my fingers down so you can see them. And if you want to just Piano fingers, just gracefully moving them up and down. I'd like for you to bring your wrists into the action a little bit. And sometimes in our weekly class, chair yoga class, we do the hula or the wave. So bring your elbows into this a bit. So notice shoulders are getting into the act. And if you want to give it a little upper body movement, do that. So what feels right for you, what feels good, take those movements. And then go ahead and relax your arms. You want to get some lymphatic movement happening in your body. So let's just take some nice, easy brushes. So take one hand or the other, and then just gentle strokes up one arm. And then some gentle strokes up the other. And then take it on up to your neck. And then just take some gentle brushes up your side, belly, other side. And if you can reach around to your low back, just give that a little brush. And then come on down to your thighs, one or the other. Favorite one first. Give it a couple brushes. Send your leg. If you can reach down to your calf, do that. If not, stay right up here to your knee. And then let's switch sides. So this should feel pleasant, right? When was the last time you've just given your body a little brush? This is good for you, good for your skin. It stimulates the lymphatic system, as I mentioned. You can actually take what we call a little soft, dry brush. You can brush your skin with it. Feels extra, extra good. And from here, we're gonna take a walk. So I want you to just start taking some steps. Lift your knees as high as you can. Then pumping your arms in unison. So we're taking a walk this morning. And I welcome you, if you are familiar with practicing and moving in a yoga class, you can do this standing. So I'm going to offer that option to you for those of you who would like to do that. All right, but I'm going to stay seated for purposes of this movement this morning. All right, I want you to notice if you can maybe feel your heart pumping a little bit more. So marching in place, right? Marching in place and get a lot of things moving, as we know. Okay, just a couple more steps. I see you all moving from side to side, so I can tell you're only taking these steps. Very good. All right, come to stillness. Rest your hands just on your thighs. Take a few breaths. Now take your arms down by your sides. This is mountain pose. Okay, so make sure your feet are nice and flat on the floor if you can. And your fingertips point down. I want you to notice if your shoulders are inching up, and just see if you can let your shoulders soften. Roll down your back a little bit. So sometimes this is hard because we have so much tension in your shoulders. So I want you to see if you can let that just soften. Just soften. And on your next in-breath, lift your arms up overhead. So for some of us, this might be our overhead, right? Some of us, this may be it. Go ahead and be generous. Give yourself a lot of space. Bend your elbows here. Remember, be kind to yourself. No need to look a certain way. Take a deep breath in. Reach up through your fingertips. We're going to take some airplane movements. As you exhale, gently swing your arms down and back and fold forward. We'll do that a few more times. Inhale, sweep your arms up. And exhale, take your arms back. Once again, inhale, sweep your arms up. And exhale, sweep your arms back. 2 more times on your breath. I'll be quiet. Beautiful. and then come back to a neutral place. Turn to the right side of your chair. So take your right knee over the edge, bend your left knee so you can be on the ball of your back foot. So remember, make sure your chair isn't moving anywhere. Place your left hand on the back of your chair or this side, your choice. Go ahead and lift your left arm up. Be generous, give yourself a lot of space, elbows bent here. And this is Warrior One. This is the Warrior series. So nice, strong stance. If you feel comfortable, you can raise both arms. Make sure that you're not going to slide off your chair if you choose to do that. But let's just take a couple breaths here. Make sure your breaths are easy. Take one more breath in. And then we're going to open up to Warrior Two. So take the sole of your left foot down, extend your right arm forward, left arm back. Some of us, this might be our extension right here, right? Reach forward through your right fingers and back through the left. So we're going to do a flow here. Flip your left palm up and reach your right arm up high. Let the left hand rest. And then bring your forearm to thigh. This is our side angle pose. Left arm rises. We're going to do this a couple more times. Inhale, right arm rises. Exhale, forearm to thigh. Beautiful. So getting into your hips a little, right? Inhale, right arm rises. And exhale, forearm to thigh. Stay right here for me, please. And take 2 more deep breaths. One more breath. And then let your left arm pull you back up. Extend your right. And then relax your arms. Gently bring your legs in together. Come back to the middle. Arms by your sides. Find your mountain pose. And then inhale both arms up. Be generous, maybe smile. And then exhale both arms back. Lean forward. Inhale both arms up. Breathing, breathing, breathing. Exhale back. And last time, inhale both arms up. And exhale both arms back. Inhale, come back up to center. Place your hands on your thighs, take a moment. Now I'd like for you to turn to your left. Now if you were on your left the first time around, I get it, because we all have 2 rights and 2 lefts in yoga, so I'm just gonna save that, okay? So again, you're gonna place your left hand on the back of your chair or on the side. Raise your right arm high, find your warrior. So here in your warrior pose, you're feeling strong, steady, rooted, right? And then reaching up, take a couple more breaths. Take one more breath in here. And you know where we're going. We're gonna open up to Warrior Two. So the sole of this foot is down, so the knees are just simply apart. We're showing our hips some love, shoulders some love this morning, and the heart is always shining open. So remember, arms can be here as well, or wherever. This might be your second favorite side, so your hands may even be down here. Wherever you are, I want you to take one more breath. And we're gonna flow. Lift your left fingertips up. Reverse your warrior. Heart shines up. And then as you exhale, forearm to thigh. So take your time, move really easy, slow, intentional. Inhale back up. Exhale, forearm to thigh. Last time, inhale up and exhale. Hold. 3 breaths. Beautiful breaths. Last breath, maybe bring a smile to your face. And then your right arm gently pulls you up. Stand both arms out for me, please. And then go ahead and release your arms. Go ahead and give that left leg or that other left leg a hand. Come back to center. Extend your arms out by your sides. Remember, you can be various places. And I want you to crisscross your arms, right over left. Extend your arms out. Crisscross your arms left over right. Inhale your arms out. This time, right hand, right shoulder, left hand on shoulder. These are our Wakanda arms, right? Go ahead and tuck your chin into your chest and just curl in for me here. Take a deep breath right between your shoulders. And then unfold, extend both arms out. This time, crisscross left over right. Inhale, arms out. Crisscross right over left. Inhale, arms out. Crisscross left arm, left hand, left shoulder, right hand, right shoulder. Curl in, tuck your chin. Come into a little ball. Take a deep breath. And then slowly unroll in hard. Inhale, both your arms out. Exhale, right hand to heart. Left hand on top of the right. Let your eyes close. How's your heart? How does it feel? So I want you to ask yourself that question. Wait for your answer. Let's take a deep breath in together. Exhale it out. Bring your palms together to touch right in front of your heart. Go ahead and sit back in your chair. Let your thumbs rest at your heart. Go ahead and bow to your fingertips. Offer yourself a moment of gratitude. Thank yourself for showing up and being here this morning with everyone you see here, and most importantly for yourself. Thank you all for moving and for participating this morning. Namaste.
Namaste. What an excellent way to ease into today's program. Thank you, Jessica. And welcome again to our panelists who are here to share helpful insights during this Heart Health Month. Dr. Grant, we saw from the slides that heart disease is the #1 cause of death in African American adults. I've got a lot of questions I'm going to ask, but the first question, why?
Yeah, I mean, that's a pretty nuanced question, to be honest. And, you know, it is unfortunate that heart disease is the #1 cause of death. And in particular, the #1 cause of death in Black women in this country. And Black women, as we know, have a higher risk of dying for heart disease at a younger age than white women. And the data is clear, and about 1 in every 2 Black women over the age of 20 in the US have some form of heart disease, such as clogged arteries, stroke, heart failure, abnormal heart rhythms. And so, you know, when we think about the alarming amount of disease burden that exists, you know, we really need to think about the root causes of cardiovascular health disparities. And really, you know, we need to be thoughtful about the complexities that exist, specifically when we think about the social determinants of health. And, you know, what we know and what's clear and what's obvious from my experiences, you know, as a cardiology fellow at Georgetown is that Black women Black people, that we're faced with an overwhelmingly high burden of chronic stress related to things like food insecurity, systemic racism, the wealth gap, the pay gap, being a part of socioeconomically disenfranchised communities, and all of these things, intermix to sort of put us at higher risk of cardiovascular disease. Many of these issues, unfortunately, have been amplified, even so, with the COVID-19 pandemic. And so, these challenges really prevent African-American people, and in particular, African-American women, from following, the guidelines of healthy lifestyles that, really are beneficial to helping to control heart disease.
Well, we're going to ask the three of you about the effects of COVID on heart health and nutrition a little bit later, but you said something that's awfully scary. Women from a very young age are subject to having heart disease. They don't know it until what?
Yeah, I mean, a lot of times in my experiences, women oftentimes can find out they have heart disease, in pregnancy, and they might have been dealing with high blood pressure in pregnancy, and then it gets lost in translation and doesn't get followed up, until they're later in life, and they're suffering from the consequences of that disease. A lot of heart disease, we think about as sort of the silent killer. Hypertension, you don't necessarily see the effects of hypertension or feel the effects of hypertension until they've caused detrimental effects on your heart. And so, again, I'm so thankful for this group of women that have come together to be thoughtful about, loving ourselves and really being really careful about, monitoring these things, because, they can sneak up on you. And if you're not intentional about loving yourself, about checking in with yourself, about, doing the heart healthy things that can, really portend to, a longitudinal lifestyle, then, these things can sneak up on you, and later in life, you're dealing with the consequences.
Well, so many of us on this program today are later in life or approaching later in life. So explain how the heart changes as we get older, and specific risk factors that more advanced women ought to be aware of.
For our wonderful seniors, the risk factors of heart disease aren't necessarily any different. Just, age becomes one of those risk factors in itself. And, the way I think about it is, as we get older, we spent so much of our lives loving others, and giving so much to our community and giving so much to our families. But it's time that we really pay ourselves and, truly invest in ourselves as we get to that age. And so making yourself a priority, making sure that, when I think about heart healthy lifestyles and prevention, it's a way of self-love. And so when you're eating proper things, when you're exercising, when you're going to see your clinician, when you're taking the medications that you might necessarily need to take, those are sort of key things that show me that you're caring about yourself. One of the other risk factors that we don't necessarily always think about is our mental health too. And in particular, as we age, anxiety, depression, loneliness, those things can sort of sneak in too. The data is very clear about how depression and, mental health issues can be very, directly related to cardiovascular disease. So really being thoughtful about all of these things is a form of self-love, and something that I feel like we really need to engage in as we get older.
This begs the question, Dr. Morton, I have never had a dentist talk to me about any kind of relationship between good dental care and cardiovascular disease. Yet we have a cardiologist and a dentist on the program. Explain to me that connection.
Good morning. I have enjoyed the segue into this question, and I realize the importance of the diet and the relaxation, the stress factors that cause all of this. But in answer to your question, oftentimes as specialists, we focus on the chief concern of the patient. A patient comes to the office, and oftentimes we find the onus of responsibility on the patient, because when we as dentists review their medical health, we ask pertinent questions about their cardiovascular health, their hypertensive health, their medications. All of the systems are followed in our questionnaire, but are we getting honest answers? Now in dental school, I have trained and taught young dentists for the past 15 years. We focus on the medical history so that we can address those questions. But oftentimes our patients don't see the importance of their oral health. They think they're just there to get their teeth cleaned, to get their teeth checked. And so they limit us to just the teeth and the gums, unless there's a specific question. So how many times have I picked up on hypertension and had to say, you're at a hypertensive crisis rate. We can't treat you until you see a physician to get your hypertension under control. How many times have I recognized that there's a rhythm problem? So I have to collaborate with your cardiologist to say what medications are safe for me to administer to you. But if the patient doesn't understand that relationship between their oral cavity to other parts of the body, they are not going to be interested in hearing that. Another thing is all practices, private practices, like every other industry, are dollar-driven. Okay, so you come into my practice, you're a new patient, you are there to get a comprehensive exam, your x-rays, your teeth cleaned. You skim through your medical health, you come into me, unless I am focused on that, unless you give me the right information, I'm going to disregard that. In answer to that question too, I wonder how many cardiologists, how many kidney specialists, how much referring are they doing to the dentist to say, look, before I proceed with treatment of this patient, I have to eliminate any oral health diseases. And so I think that the onus of responsibility is on both the patient and the dentist to address these things. And from a personal standpoint, the things that I have identified early on with the, when we first in the 80s, when AIDS, when we first recognized AIDS, HIV, there were patients who came into my office that I was treating for periodontal disease. My recommendation is go back to your physician and let's get some lab studies done. Their response to me is, why do I have to get lab studies done? Why are you as a dentist ordering lab studies? And that's because I see the direct correlation in the HIV, AIDS, in the oral cavity. Another personal story, one of my dear friends was in my chair, treating her periodontal problem. I didn't review her medical history. I simply said, what diabetes medication are you on? She took offense to that. Iris, I'm not on any I'm not diabetic. I'm not on any medication. So she left the office very unhappy with me. We are still good friends. Fast forward a week later, she was in the hospital with a diabetic crisis.
Well, you know,
That nice segue into this presentation was very important to me, because we talk about nutrition. Where does the process of digestion start? Right in the oral cavity. We were doing our yoga exercises. We were breathing, right? Where does that respiratory process start? Right through the oral cavity. Now imagine this, a rusty gasoline tank, but then right there's where you put your gasoline, okay? So in answer to your question, the dentist too is driven by the time that is allocated to doing the procedure and what he bills for. This is America. And then we are limited to your knowledge and your understanding of the importance of your health to the oral health.
Dr. Morton, I think the takeaway here is, as with most things, it takes a village to get it right. The cardiologist, the dentist, and certainly the nutritionist. And maybe one of the most important partners in all of that is the patient, because you have got to be honest about what you feel and communicate that. And you got to be honest about what you're doing. And then you've got to advocate for yourself. So we're going to come back to you a little bit later, because I have some specific questions about oral health and the heart. But let's talk a little bit more about cholesterol now. We started that in an earlier segment, and I want to ask both Dr. Grant and Ms. Key, this cholesterol thing, is this something that you can test yourself for at home, or do you have to be with a medical professional? How do we monitor and keep our cholesterol on track?
I can start. What I do recommend for preventative measures for myself, for my family, for my patients, at least once a year, checking your cholesterol, with your clinician, with your doctor. You can do twice a year if you do have issues related to cholesterol. And like was mentioned earlier, there's lots of different types of, cholesterol, LDL, HDL. And so those things are important that you review the ratios of your cholesterol levels with your provider. There are at-home kits that you can use to check cholesterol. Unfortunately, not many of these are sort of FDA regulated. And so the validity of that number is not always as accurate as would be if you're getting their blood drawn at a provider's office, and that's being sent out for specific FDA validation. So, I do recommend, at least once, maybe twice a year, getting those levels checked, and then being very clear with your doctor about what are my specific cholesterol goals, and then adjusting your diet, potentially working with a registered dietitian about getting a diet specific sort of plan that can, help fit you to the cholesterol goals that you establish.
Ms. Key, did you have something you wanted to add?
No, actually, he said, I was just going to say, whenever the doctor gives you, if you're diagnosed with high cholesterol, you should talk to someone to help you with your diet specifically tailored to you.
Are there specific foods that can reduce heart disease once someone has already been diagnosed?
Absolutely. It's the same before you're diagnosed, it's the same after you're diagnosed, right? So if you are focusing on vegetables, again, green leafy vegetables are really powerful for helping to lower your cholesterol levels. Most non-starchy vegetables, including sweet potatoes, even though they're starchy, I would include that as a really good way to, sweet potatoes are good for so many things, including diabetes, and people think that because they're sweet, they're not good for you, but they actually are really good. And then also, instead of eating like foods that are high in saturated fats, focusing on the lower saturated fat foods. It looks like my internet connection is unstable. Can you still hear me? Okay.
We can hear you, yes.
Okay. Yeah, and focusing again on the lower saturated fat foods, because the saturated fat, the saturated fat is the thing that spikes your cholesterol. So again, fatty fishes like salmon, wild caught, of course, is the best. And then albacore tuna, things like that. Olive oil is a really good option, especially when you're, instead of salad dressings, when you're using a salad dressing, instead of using like a ranch or something, you can put like a nice olive oil and some vinegar, maybe add a little honey for a little sweet taste. And that's a little tip as well to prevent you from eating like more sweets. It's always good to add like some type of like fruit or a little bit of honey or maple syrup into a dressing, because that actually addresses your sweet craving. And so you won't go for those high saturated food, those cookies and things after eating the salad. So I found that works a lot well for a lot of the people that I work with. So yeah, I would say that.
All righty. Dr. Morton, let's get a little more specific. I'm sure that over the course of your career, you have seen people with dentures, partials. What's your best advice for caring for your oral health when you also are dealing with these issues? And how does all of this correlate with preventing gum disease and staying heart healthy?
Okay, first let's address, we won't get into addressing why you have the dentures in the first place, because 95% of the diseases of the teeth and gums are preventable. So we will not get into the risk factors that cause people to lose their teeth. But since they have been lost, let's think about how to care for them. Now, it's like any other artificial part of your body. It has to be clean. It has to be sterile. And it has to have a proper fit. So let's say we are dealing with a improperly fitting full denture. And as you chew, as you masticate, as you use your oral cavity for speech, that this item is moving up and down, and this item isn't fitting, and this item is irritating the soft tissue, then we're going to get an inflammatory process that can then turn into an infectious process because of the bacteria that's in the oral cavity. So we prevent that by keeping the device clean and making sure the device is properly fitting and we are able to use it for the purposes that it is designed for. It is designed to restore the function of the oral cavity to chewing, to masticating your food. That's where that digestive process starts. And so we want to have a good fit, and we want to keep it clean. And we have to give the tissues a rest. So you treat that denture like you would treat the teeth in your mouth, cleaning it after every meal, making sure that you're using something to disinfect it with, and then relieving your tissues of this irritant.
Now, as we get older, we often find ourselves slowed or sometimes impaired. Arthritis, fingers don't move like they used to, any number of daily life issues. Back to the dentistry aspect. Now, can you suggest, or let me ask it this way, what do you recommend for patients who may have arthritis in their fingers, or they're dealing with mobility issues of some kind, how do they best maintain their oral health and, Dr. Grant, their heart health? Because if you've got mobility issues, you probably aren't exercising the way it is suggested that we exercise. So we'll start with Dr. Morton.
In maintenance of the oral health, there are so many gadgets that are available now. As a young dental student, way back in the day, before any of you were probably born, there were toothbrushes before they became mechanical toothbrushes. We at Howard devised ways that we could enhance the handles of those toothbrushes. You know, we would expand the handle so that instead of something that fit like I'm holding this pencil, we would have something large around it so that that arthritic patient could grip it. And then there were ways that we suggested getting the toothpaste out. If you could just put the toothpaste, instead of squeezing it, because your hands won't squeeze, just put it on a flat surface and get the toothpaste out of the container by pressing on it. But now with the advent, and flossing was a real problem, being able to maneuver the floss, and we came up with floss holders. Now, with technology, there are automatic flossers that we could use. The handles are larger and expanded so that you could get a gentle grip. And those are for patients who are still self-care and don't require aids and assistance with their oral health. And so I would recommend the automatic toothbrush. I would recommend the automatic flossers. Those flossers, some automatic flossers have a rinse that you could put in. I would recommend those that you add that rinse to your floss, and some of them you, depending on what your dentist prescribes, if you're suffering from dry mouth as a result of medications you're taking or some disease, if you're suffering from recurrent caries as a result of your chemotherapy or radiation therapy, or just decrease in the saliva to cleanse it, if you're on any types of medications that cause dry mouth, there's a rinse prescribed for that. If you, and so you could add those rinses to that automatic flosser that has water in it, and it's easy to maneuver around.
So what I'm hearing is no excuses. There are ways to take care of yourself the way you should.
Yes, yes. And when it comes to nutrition, the very hard, sticky, and chewy foods are going to become a problem. But we always say to the caregiver or to the person who's doing it, cut your foods in smaller parts, and then you're able to masticate those foods and get the nutrition that you need.
Sounds like a plan. All right, Dr. Grant, they tell us we're supposed to exercise a minimum of 30 minutes a day, 5 days a week. If you've got mobility issues, what do you do to maintain your heart health?
Yeah, I mean, I think that's such an excellent question. And I really want to tie this back to something Dr. Morton said when she said about 95% of, oral pathology can be prevented. And for me, and, this is intrinsic of what I believe, I think prevention really is centered in self-love. And even if you aren't as mobile, that doesn't mean you love yourself any less. And so, I really recommend the American Heart Association has something that they guide us to, and it's a nice takeaway, and they call it the Simple Seven. And it's simple 7 things that we can do to really focus on our heart health. That is managing your blood pressure, controlling cholesterol, reducing your blood sugars, getting active. And that active may look different for you if your mobility is different, And the goal of activity is only essentially to raise your heart rate. So whatever you have to do to raise your heart rate, that I'll accept that, and that feels good to me. For me, that may be running a couple miles, but for someone else, that might look a little bit differently. And so getting something that is sort of individualized to yourself health to get your heart rate up, it is what we want. The other, aspects of this, the simple 7 are eating better, losing weight, and not smoking. So those simple 7 things, I mean, even if your mobility is not as it was, you can still focus on a lot of those things.
All right, we've got just a very few minutes left, but I've got to address the elephant in the room, and that is COVID-19. How have you been able to help your patients and Ms. Key, your clients, stay on the course of good heart health, good dental health as it correlates to heart health in the midst of COVID?
So actually, it's very interesting because COVID actually made people cook more from home. So it was a little bit easier for me to work with the people I was working with because they had to stay home and cook. And so they had more initiative to do that. So honestly, it was good in that regards. I think the biggest difficulty that I experienced as a dietitian was access to food and making sure people had access to food. So I work at Capital Area Food Bank. So I was able to direct people to places they could go to get specific foods. But in general, I think, and then I also think that there was a hunger for like understanding nutrition more because people wanted to boost their immune system more. And so the whole vitamin D and talking about the importance of vitamin D, and highly recommend that supplement for elderly. And I talking to your doctor about taking a supplement that's right for you. But I think overall, surprisingly, there were a lot of positives that came out of COVID as opposed to what you might think negative. I know that's different for the medical scene, but for the nutrition and dietetic scene, I think it was a little bit easier for us, honestly.
Dr. Grant, I'm going to give you the final word, but Dr. Morton, really quickly, I'm embarrassed to say I went a year without getting my teeth cleaned because I did not feel comfortable going into a dentist's office. So what say you, how are people surviving the right way in the midst of COVID in terms of their oral health?
In terms of their oral health, there were a lot of people just like you. And the dentists had to adjust their offices considerably during that period. Because, lots of things, the equipment that we use generate aerosols. And those aerosols were the things that we were concerned about infecting the patients or the patients infecting us. And so instead of looking like healthcare providers, the office looked like we were space cadets with preventing the spread of the disease. Generally, the patients who had good oral health, you just encourage them to keep up with their good oral hygiene. It's amazing how teledentistry came into play at that time because all of us have cameras. And if there was an issue that was of concern of any infections going on, you were able to screen those via teledentistry and then bring that patient into the office. So how did it affect the office flow? Scheduling fewer patients, not having patients wait, and then providing the protection that they needed from the aerosols that we have to use in their preventive care.
Thank you.
But
I gotta move on. We don't have much time left, and I want to give Dr. Grant the final word. In the midst of COVID, how do we maintain good heart health?
And so, obviously COVID is devastating. Me personally, I mean, I've had COVID twice myself. I've got it from patients in the hospital, and, it's been really detrimental, on, our mental health and, everything that we bring to, our jobs as clinicians. The one silver lining that I think has been excellent and pertinent to this conversation in our group that we're talking to is COVID has created this opportunity for us to go outside the hospital walls. In particular, when I think about my elderly patients, I don't necessarily love them having to commute to the hospital to see me, for visits, initial visits, follow-up visits, et cetera. And so, when we come up with a treatment plan now, I schedule maybe a 5-minute phone visit, in 2 weeks, just for me to check in with you and to establish establish relationship and just to see how things are going. And so it's given us an opportunity to go outside of our hospital walls to really ingratiate ourselves in the community, which I think is essential for building, positive relationships and thinking about heart health.
Thank you so very much to our panelists. This has been valuable. I hope you, our audience, feel better equipped to make a healthy start for a healthy heart. Jasmin, back to you.
Thank you so much, Diane. And thank you so much to our panelists for that lively discussion. I believe we have a few minutes to answer some of the questions that we captured throughout the presentation. And so I will ask just a few of them now. I will ask that we keep our answers brief if possible, as we are nearing the end of our presentation here. I will first ask Ms. Key. We have a question about options for protein-rich yogurt for those who are lactose intolerant. Do you have any suggestions?
That's a great question. I would recommend a lot of the soy products or the oat milk products. The only problem with that is that you're gonna have less protein and not as much calcium. So I would just recommend that, if you go with the vegan options, then just make sure you pay attention to the amount of protein and try to choose the ones with the highest amount of protein and calcium.
Okay, one additional question for you, Ms. Key. We have a question about healthy substitutes for people who may live with nut allergies.
So, that's a good question. So there's, unfortunately, it's not, it's expensive, more expensive, but there's like a sunflower butter that you can actually use. The sunflowers seeds are actually not relevant to, if you have a nut allergy, you may be able to eat sunflower butter. So that's a really great alternative. But in general, if you're just looking to get the protein and the healthy fats and things like that, I would recommend basically doing like focusing on just like other healthy fats like olive oils and fatty fishes and things like that. And then for protein, focusing on beans and lentils and plant-based products and things like that.
Excellent, thank you so much. We have a question for Ms. Jessica Howard-Jackson, actually. What are a few examples of a low impact exercise that can still get our heart into that healthy heart rate range?
Oh, wow, it's a great question. Thank you for it. As far as what we did at the beginning of the session, the marching in place, that is actually a wonderful low impact way to get your heart rate going. And if we had continued that for a minute or 2 minutes, you would definitely notice that your heart rate was rising. So adding your arms, lifting your knees a little higher, those are two wonderful ways that are low impact because you can be on a soft surface, you don't have to leave your home. That you can get your heart rate going. So my specialty is in the yoga practice, and as far as getting your heart rate up in yoga practice, it's the longer held movements that might feel like a stretch for you. So I know that we did our warrior series, we had our arms raised, and your heart rate's not going to get super high doing those movements and holding them, but you're going to feel a difference in your heart when you do this and you continue to hold it for a period of time. So those are some nice, if I could give just quick ways to raise your heart rate in a low impact manner that I can offer.
Excellent. And one other question for you is, we talked a lot, I know that Dr. Grant spoke about this as well, but we spoke about as part of loving ourselves and loving our health, how mental health comes into play. Can you share with us about how yoga can help with regulating our mental health or keeping us on a good sort of range for our mental health and keeping stress down?
That's a wonderful question as well. One way that I like to offer is just by pausing in your day It could be in the morning when you first wake up. It could be, somewhere throughout your day. Maybe you're taking a break, maybe not, but just stopping to just pause all movement, all activity, and even just watching your thoughts. So not necessarily letting them go away or stopping them, but just stop it, be still. Maybe notice the temperature of the room, any smells or anything else your body may sense. You can close your eyes and then just take a few deep breaths. And then in that, you have an affirmation that you like, or even just something as simply when you breathe in, say, I am, and exhale, love, or I am gorgeous, whatever that is for you. You can add that mantra to your breath, and that'll help you keep count of that. And you'll notice over time how quickly or how easy it is for you to get to that point of pausing. But we get so harried in the day, and we're moving and rushing, that we forget ourselves and leave ourselves behind. And one way to take care of yourself is to make yourself a priority and stop and just notice, like we did today. How's your heart? How does that feel in your hand? Maybe how is your breath in your body? And there's no right or wrong answer. You're just taking the time to notice, and noticing yourself, I believe, is the first step to just caring for yourself in a very particular way.
Thank you so much for those answers. We are running a little bit out of time, but we've captured all your questions. I want to make sure that the attendees know that, and we'll do our best to have those questions answered for you. I want to thank you again to our panelists and also to our audience for those thoughtful questions. In a few seconds, you will see a survey link dropped in our chat box. Please take a moment to click that and answer a few questions about our presentation today. Before we end our program totally, we do have 3 giveaways, just to say thank you for your time and your attention. Our first prize, which is a copy of Tabitha Brown's Feeding the Soul, as well as a primary care bag, goes to Marlo Johnson. Congratulations to you. Our second prize, which is an electric toothbrush, our lovely winner there is Lachelle Harrison. Our last prize, which is an at-home blood pressure cuff, goes to Chanel Howell. Congratulations to our winners. Please look for your prize to be mailed out to you within the week. At this time, I would like to turn our presentation over to our our president, Raven L. Hill, to give closing remarks.
Good morning, and everyone, if we could please give a round of applause to our outstanding panelists and moderator for sharing a wealth of information this morning. I know I feel so much better informed than when I started my day, and I did not have a healthy start to my day, so I'll do better tomorrow. But I also want to thank Katrina Richardson, Jennifer Coleman, Sharon Holt, and the entire Women's Healthcare and Wellness Committee for coordinating this event. It's been fantastic. For our senior neighbors and friends who are with us this morning, who are not currently part of Monday activities, we invite you to join Monday activities every Monday at noon, except for holidays, for Mind Movement Menu, where you can get more information like this you received today. We'll show you how to stay healthy physically and mentally, and how to eat well seasonally. And for more information on Monday activities, please contact programs at akaexo.org, and we'll get you linked in. Please keep in mind, as we heard from our panelists today, that healthcare is self-care. Make yourself a priority, make your health a priority, and enjoy the rest of your day. But thank you for coming.